Okay, hello everyone. I am here with my group mates Juan Climaco, Lawrence Clarit, Pia Labio, and Yuan Copra. Today, we are going to be discussing the healthcare of the Philippines, especially tackling the past and present healthcare practices, transitioning of traditional to modern healthcare, and the conflicts that occurred during the adjustment from traditional to modern. We are going to be starting off with our first presenter, Juan Climaco, to discuss about the past practices.
So hi everyone, I'm gonna talk about the past of the healthcare here in the Philippines. So the present day Filipino culture still embraces superstitions that cling to ancient beliefs and practices. Some may be quite amusing, such as serving noodle dishes like pancit during birthday celebrations, as it is believed to represent long life, while some sound more serious, like thinking that faith healers can heal certain ailments. A brief history of the Filipino healthcare. Healthcare in the Philippines extends as far back as the 15th century, prior to the arrival of the Spaniards. Life and by extension healthcare was centered around the animate and inanimate world. Traditional Filipino medicinal herbs were used for a wide variety of ailments. Anonas leaves were applied to the stomach for indigestion. Betel nut leaves and areca nut leaves were common for injuries, chewed and then applied. Sambong was used to treat kidney stones, rheumatism, coughs, colds, hypertension, and diarrhea. Next slide, please. So where did these superstitions come from? Most early Filipinos believed in worshiping different gods, creatures, and spirits. They appeased them through various practices, sacrifices, and rituals. However, due to the Filipino having a long history of colonization, religious beliefs and traditions have changed from animism to Christianity. In marrying animism and Christianity, the impact of Filipino superstitions remains to affect everyday life, spanning from fortune, love, and marriage to family, illness, and death. Next slide, please. Next slide. So these are some health superstitions, but before. So these are some health superstitions of Filipinos. First example is the namamana. It is a Filipino translation of acquiring a behavioral or disease trait from a parent. Next is lihi. It is a concept used to explain why some children are noted to have certain specific characteristics. Sumpa and gaba. These are beliefs in the Filipino culture pertaining to a curse. Namaligno is a Filipino belief that a disease is caused by an intervention or a supernatural or mystical being. One example of a mystical being here that is common in the Philippines is like a kapre. Next is the most common, kaloob ng Diyos. This is the most common belief here in the Philippines. It means God's will. Next slide, please. Other common health superstition that causes common diseases. Um, these are like the superstitions that needed to be done in order to not to acquire these diseases. Getting rid of a hiccup by placing a short thread wet with saliva on the forehead. Next, washing sweaty hands can lead to spasmodic hands or pasma. Not patting your sweat dry with a towel can cause you to get pneumonia. And lastly, stepping over a child will stunt his or her growth. So, so these are these are the past of the health superstitions here in the Philippines. I'm gonna pass you on to Lawrence James Carriet to talk to you about the transition from traditional to modern healthcare.
So, transitioning from an anecdotal remedies such as plants and herb mixtures to more scientifically proven medicines. So, pre-transition, before the age of proper medicine in the Philippines, superstition and complementary and alternative medicine, also known as scam, and herbal preparations reigned supreme. In the Philippines, one of the many ethnic minorities with rich traditional knowledge about the use of medicinal plants and herbal medications are the Ati Negro people of Guimaras Islands. The ethnic group from central Philippines, however, is particularly recognized for having good knowledge of traditional medicine. And as peddlers or ambulant vendors, the use of gum, although it is common among women of reproductive age, still has unresolved or underlying mechanisms behind its effects. if not lacking strong evidence of its effectiveness. Post-transition, the earliest record of true and defined healthcare was the American era of 1898 to 1918. Board of Health for Supervising Public Health was established on September 29, 1898. The Board of Health's biggest challenge was smallpox, which they battled by standardizing vaccine production and campaigning for vaccination. The Department of Public Instruction, one of the four executive departments of the government, was in charge of the Philippine Health Service. The Philippinization of health services started when Doctor Vicente de Jesus, the first Filipino assistant director of the Department of Public Instruction, became director in 1918. While there is some anecdotal evidence of the efficacy of camps, traditional remedies are unable to compete with science-backed medicines. The tradition from pre-colonial remedies to post-American way of healthcare was very substantial and had a huge impact on the disease it cured and prevented. Although PhilHealth and DOH are not the cream of the crop when compared to the global stage, but looking back at our history, we have come a very long way. So now I will pass you on to Yuan Compra to talk about the present or modern day of healthcare.
Present, huh? Time flies so fast that everything changes around us. As time change, medicine also change. It starts with our folk medicine practices to medical technologies. But I'm not here to talk about the past, but I'm here to talk about the present. So let's rock the stage and get going. There are five current medical technologies here in the Philippines. It's what you call the Axis Knee System, RxBox, Ihatid, Biotech M, and Ultra. These technologies that were built by our beloved Filipino citizen are all for healing for the most rampant diseases here in the Philippines. So we should thank our Filipino developer for this technology. Let's start by talking about Axis knee system. As in knee, so it helps our D, but it's true replacement and it's cheap than others. So this means that it's true surgery, but surely it's better than others. RxBox. This is helpful because it stores our medical records, and this device doesn't really need unnecessary travels because it enables diagnosis, monitoring, and treatment of patients. Ihatid is a medical tablet. It even works without internet connection, so it's very usable and it gives health information and it creates sounds and evidence based on health policies. Biotech M is for dengue diagnosis and as we all know, dengue is a rampant disease in the Philippines, so surely this device can help us minimize rampant diseases here in the Philippines. All-trap is also used for dengue, but it is a control method for dengue. So this device is very useful for us because it stops the rampant dengue diseases here in the Philippines. To conclude what I say, we should support and we should appreciate these five technologies because it really helps our healthcare system here in the Philippines. It may not be the best, but surely better than the rest. So so I'll pass it to Zali Teres Pasuelo for more information about the adjustment period.
Okay, thank you, Yuan, for that wonderful reporting. And today we're going to be discussing about the conflicts that has happened after transitioning from past healthcare to present healthcare. So what we meant by conflicts are the reaction of modern day doctors to so-called healthcare beliefs that somehow was allowed by traditional doctors to take or do for their patients. Survey has shown that most people follow religious healthcare medicine and practices before and might still do now, but to a lesser extent than before. Modern day doctors have also said that the reason they choose faith over medicine is that because of their broader society, which means that it has been around from generation to generation. So, in relation to this conflict, doctors are patient about this due to the fact that culture has really made a big impact to what they are doing. Physicians try really hard to persuade their patients to stop whatever they are doing that can cause harm to their health. Filipinos have an unfavorable attitude towards formal help seeking. They actually prefer to ask help from friends and family, and it explains the fact of our lack in health insurance, immigration statuses due to our medical informations. So, as you can see, in other parts of the world, health insurance is a must for emergencies. Well, in the Philippines, they don't believe in that. One brief example I can give is the incident that happened last 2020 during the ongoing COVID 19. Cebu Province's Governor Gwendolyn Rama Garcia rather, goes off to a young doctor about her opinion on tuob. So she names and mocks her through Facebook Live because she only had 2 years of experience of being a doctor. And all I am saying is when society change, it doesn't really agree immediately, especially when there is adjustment happening. So Pia, maybe you have anything to say?
Next, next slide, please. Next. Okay, so upon doing our researches, we came up with this saying or quote: culture greatly influences the society and health. So one's cultural beliefs affect one's perceptions of health, illness, and death. They have certain beliefs about causes of disease, whom they, whom they seek health care, and how they respond to the differences to the different treatment recommendations. And that concludes our uh, presentation, and thank you.
Thank you, guys.